Myself, Manoj Prasad, Assistant Professor at Bharat Institute of Higher Education and Research. Today, we're going to discuss about the topic in pacemaker. What is the definition of pacemaker? A pacemaker is a battery operated generator that initiate control electrical stimulation of a heart via an electrode that is usually in direct contact with the myocardium. We know that SA node is an important and natural pacemaker. What is the meaning of SA node? Sinoatrial node. The sinoatrial node is a natural pacemaker in our body. So that SA node, sinoatrial node is an electrical impulse is conducted, generated in naturally. So that for the persons are filed in SA node, the patient need a pacemaker because SA node is failure, so that pulse generated is not done in proper manner. So the patient needed a particular pacemaker based upon their requirement. Mainly if pulse failed, they need a pacemaker. What are the pacing modes? Temporary pacing, the pulse generated is external and pacing electrode is inserted transvenous, transthoracic, transesophageal, or transcutaneous route. Either based on selection process, the temporary pacing method, it can be either inserted either under the bedside or a fluoroscopy. Continuous, the transvenous route, which is preferred in emergency situation. It's a required heart tip or a balloon tip pacing a lead to be guided into the right heart into the contact with endocardium level. This is the temporary transvenous pacing wire in right ventricle inserted through anticipitaal vein. In this place, you can be able to see this bridge cable is connected with the pulse generated, the transvenous wire inserted into the anticipitaal vein. So that pulse generated through anticipitaal vein, it's generating the pulse, can be current flow is passing to the single level. The transvenous installation. What is the meaning of transvenous? It is the permanent pacemaker wire you are inserting the person. The transvenous installation of a permanent pacemaker. Because in this place, for a dual chamber pacing, a separate pacing wire would be in atrium. They are selected three types of vein. One is subclavian vein, second one is axillary vein, third one is cephalic vein. So based on the simple surgery, they are inserted into the transvenous pacemaker. Transvenous thoracic route is most invasive, requiring attachment of an epicardial pacing lead during a open heart surgery. In infant needing emergency ventricular pacing in transesophageal route is favored. So both transcutaneous and transesophageal pacing are preferable in the presence of coagulation abnormalities or venous access difficulty patients. Permanent pacing. In operating room, the pulse generated a small hermetically sealed with the help of lithium batteries weighing from 30 to 130 gram is placed into a small tunnel with subcutaneous tissue below right calvic. The less frequently the left calvic. So the basic electrode is inserted via transvenous route, most common, so directly applied epicardial surface by transthoracoectomy. Ectomy means removal. These are the different waves. You people are able to see these two type of waveforms. In these two type of waveforms, one is the normal patient affected with the heart disease. It is an atrial fibrillation waveform. Another one is with pacemaker inserted patients getting these type of waveforms. We know already the SA node failure, the patient needed a pacemaker. So the pacemaker while inserted, while it is in a either outside or inside the body. Some patients needed the temporary, some patients needed permanently. Based on physician consult with inserting the pacemaker. So once the pacemaker is inserted, the waveforms would be coming like this. It's an electrode. It's inserted in the pacemaker, right side in one single electrode. In this place, unipolar, bipolar leads is inserted. The pacemaker classification. The Inter-Society Commission for Heart Disease established a code to create uniform distribution or a description pacemaker function. They analyzed, they are giving the pacemaker classification in letters. The first letter indicate chambers paced. V means ventricles, A means atrium, D means dual. So both atrium and ventricle. It is a first letter. Second letter, it indicates which chamber is sensed. First, V ventricles, A atrium, D dual, both atrium and ventricle. O means no sensing. Third letter, it indicates the mode, how the pacemaker responds interesting heart pulses while is inserted, how the pacemaker is working, how the pulse is generated in proper manner, either it is in a unipolar type or bipolar type. Is inserted, we going to monitor the pulse level and waveform level also. I means inhibited response. Second, T. T means trigger response. D, dual response. Yeah, inhibited for some sense impulse or trigger for others. Or reverse, the pacer is activated to send out impulse during a fast interesting heart rates inserted or slow. We going to analyze these type of interesting rate also. O means no response in sense the impulse rate condition. Fourth letter, it indicate programmable function. First, P programmable rate / output level also it can be generated. M multi-programmable, 3 or more functions during the time. C multi-programmable with telemetry. O means none. Fifth letter indicates special tachycardia functions. Burning sensation, normal and abnormal, it can be classified. Scanning and external levels. What is the main function of pacemaker? The cardiac cycle normally being a with client's own beat. The pacemaker sensor sends whether intrasonic beat has occurred naturally. If it not occurs in naturally, we know that SA node is natural pacemaker. If a SA node failure, the patient needed a pacemaker, either permanent pacemaker or temporary pacemaker. If not, the pacer sends on output and impulses doing behind myocardial depolarization is not done in proper manner. Through pulse generated, we can regenerate the pulses in electrical stimulation of pacemakers. Impulse generated is set capture the myocardium. There is a maintain a heart rhythm. That's why we are impulsing or pulse generating with the help of pacemaker. Pacemaker leads. First one is unipolar pacemaker lead. It is the most common lead. The type of lead has only one electrode that contact the heart, its tip positive pole. The power of source is a negative pole. The patient severs as grounding. Based on the patient needed, the body fluids provide the return pathway in electrical signal, and electromagnetic interferences occurs more often in unipolar leads. This is an unipolar pacemaker. In this place, pulse generated in positive condition, the direction of current flow in the single way. Next, the another negative pole is an ground. Single lead pacing is connected in unipolar pacemaker. Bipolar leads. If a bipolar, there are two wires to the heart or one wire with two electrodes at tip. Again, I am repeating. In we know that in unipolar, a single lead, the pacing lead, we can generating the pulse. But in bipolar, there are two wires to the heart or one wire with help of two electrodes at the tip to provide belt ground lead circuit completed with the heart. So it provides more contact with the endocardium, needs lower current to pace, less chance of quitting it. This is the bipolar pacing system. We already know that there are two wires to the heart or one wire, two electrodes at the tip. In this place, only one pulse generated, but how many anode? Positive, 1, 2. There are 3 or more positive electrodes are placed. 1, 2 cathode electrodes. In this bipolar is direct flow at the same time, inlet and outlet flow also doing in same lead. This is the bipolar pacing system. So that ground lead circuit is completed with the heart, provides more contact with endocardium, so that need lower current, pace less. So in this place, you people able to see this. This one cathode is connected in the under top of endocardium level. What is the pacing modes? There are essentially 5 pacer modes involving in pacemaker system. One is a single chamber pacing, either atrial or ventricular, and dual chamber pacing, or both atrial ventricular pacing mode also doing. First one is fixed rate. The fixed rate pacing a heart is stimulated at continuous present rate independent of its intrinsic electrical activity in non-sensing method. The major disadvantage is this competition between paced beat and the pace and intrinsic rhythm may occur. Potentially, it's different. So it may be coming with ventricular tachycardia and fibrillation. The main chances these type of bipolar leads while paced inserted into the patient just with a fixed rate pacing, the heart stimulated in continuous method, the present rate independent of its electrical activity in non-sensing method. So non-sensing may occur potentially ventricular tachycardia. These are the complications will be coming under fixed rate level. Next one is non-competitive demand pacing method. The demand pacemaker avoids the competitive beating by sensing the electrical signal from the chambers. It is a pacing either atrial or ventricular. Demand pacing either inhibited or triggered. In the waveforms, it can be different each and every pacing method. So Fixed rates is different in electrical activity. In non-compatibility demand passing method also is different. We know that the normal electrical waveform of ECG, PQRST. In this pacemaker patient, the normal electrical waveform should be different. If the spontaneous P wave or QRS complex fails to occur, the pacemaker discharges at its present delay interval. In trigger demand pacing, the sensing of the spontaneous atrial or a ventricular activity results in generation of an output pulses by the pacemaker. Atrial demand pacing. The atrial is paced, the ventricular is allowed to be depolarized via conduction of the paced atrial impulse through the normal pathway of the AV node and Brinke system. Atrial demand pacing is useful in sympathetic sinus brachycardia of kind provided AV conduction intact. So atrial demand pacing mainly is focused in demand pacing useful for symptomatic sinus bradycardia of the kind of symptoms having the patient. The patient allowed to depolarize by conduction paced atrial impulse through the normal pathway of AV node. Second one is ventricular demand pacing. The patient with episodic AV block may benefit from ventricular demand pacing when spontaneous ventricular depolarization fall below present pacemaker rate. So the paced ventricular depolarizations ensure ventricular demand pacing then needed. Mainly the patient episodic AV block may benefit from ventricular demand pacing method so that the pacemaker fall below present pacemaker rate. Paced ventricular depolarization ensure. What is the main disadvantage this type of demand pacing method? And is loss of atrial ventricular synchronizing rate and atrial kick. These are the main disadvantage of ventricular demand pacing. Synchronized pacing method. What is the meaning of synchronize? Continuously. At the same time, synchronized pacing was first developed to offer dual chamber pacing. Atrial and ventricular, both sensing occur in both atrium and ventricle. When P wave is sensed, a ventricular output pulse is triggered after a present atrioventricular interval. If spontaneous QRS complex is sensed, the paced output is inhibited, thus preventing competitive pacing in the ventricular. We know that normal ECG waveform is not occur when the pacemaker is inserted to the patient waveform. So if the pulse is not generated while we are inserted the pacemaker also, we're going to analyze the pacing method. We're going to abnormalities condition we can check very clearly with the help of waveform generation. So the spontaneous QRS complex is since the paced output is inhibited, thus preventing competitive pacing in particularly ventricle level. Next one is universal atrioventricular pacing in universal level. So it's both atrio and ventricular pacing. If a spontaneous atrial activity does not take place with the present time limit, again I'm repeating you, a present time limit is spontaneous atrial activity does not take a place within the present time limit. So atrial placing that time only it's triggered. Any sense intrasonic atrial activity inhibited the placed or the paced atrial pulse is generated. So, if a ventricular depolarization is response to spontaneous or a spaced atrial beat does not occur within a present interval. So that particular present interval does not occur, we need to generate a ventricular stimulus is issued by the pacemaker. Again, I'm repeating you, it's one of the major method using in universal level, universal atrial ventricular pacing method. An atrial activity does not take place within the present time limit. The present time limit atrial activity does not take place. Mind thing. The atrial pace level is triggered. Any sense intrasonic atrial activity inhibit the paced atrial pulse if ventricular depolarization in response to spontaneous or paced atrial beat does not occur within a present interval. So the particular time the ventricular stimulus is issued by the pacemaker. What are the main benefits of universal pacing? It allows the atrial kick increasing a cardiac output by 30%. In Indian Council of Cardiac Association, it's telling universal pacing atrial kick increasing a cardiac output by 30%. It can be adjust heart rate to meet metabolic demands of the body only if a sinus node function is normal. Sinus node is sinus in sinoatrial node. Electrical impulse, that particular function is an abnormal condition. That particular abnormal condition only the universal pacing method is stimulating. What are the complications? Mainly, why we are inserted pacemaker. After inserted the pacemaker, age-related patient may get arrhythmias, pneumothorax, myocardial preformation. Myocardial preformation. It's a major after inserted the temporary pacemaker. At the same time, permanent pacemaker patient getting a major complication in myocardial preformation. At the same time, if the patient is not maintaining the battery level while the patient inserted the pacemaker before 10 years, the patient not maintaining the pacemaker, if getting the patient stroke at the same time arrhythmia, diapaumatic stimulation level. So the battery level is very low. It can